Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ahead of the takeoff of the National Sports Festival in Benin City, organisers and participants take mandatory COVID-19 vaccination, promise to obey all NCDC protocols during event. The index case state Ogun makes progress in flattening the COVID-19 curve, vaccinates over 58,000 people. And India's daily COVID cases surpasses 100,000 mark for the first time. According to reports, globally, variants of concern are being transmitted, with younger people getting sick. While some countries have tighter restrictions in place during the Easter holidays, others are easing restrictions as vaccinations pick up. In Nigeria, the NCDC is wishing all Nigerians a safe and healthy celebration, with a reminder that the COVID-19 pandemic is not over and to avoid large gatherings in crowded places to keep everyone safe. The agency reported 82 new infections in the last 24 hours, a rise from the single-day count of 50 cases recorded in the previous 24-hour cycle. According to data published by the Nigeria Center for Disease Control, the new infections were reported from 8 states, including Lagos, Yobe, Abia, Rivers, Imo, Akwa Ibom, Katsina, and Osun states. Since April the 1st, the agency has been reporting less than 150 daily COVID-19 cases, and the new tally now brings the total number of confirmed cases to 163,195. Over 2,000 deaths have been recorded in 36 states, and the FCT, the health agency, says 145 patients have been discharged after recovering from the disease, increasing the total recovery count to over 151,000. Daily deaths from COVID-related ailments have declined in the past 2 weeks, with no fatalities recorded in the past 48 hours. Less than 10,000 cases are currently active. The ongoing COVID-19 global pandemic has altered normal activities and led to the postponement and cancellation of a number of national and international events, and the sporting world is not left out. In Nigeria, the biggest item on the country's sporting calendar, the National Sports Festival, has witnessed a series of postponements in the past months. And now that activities are set to commence tomorrow, the organisers have made vaccination for COVID-19 and testing a mandatory requirement for athletes and participants in the 20th edition of the Sports Festival.
Some states have gone ahead with the inoculation of their athletes in preparation for the National Sports Festival to ensure they are free to train, travel and compete. Athletes and coaches alike have received the vaccine in some states. In Bayelsa, the government is assuring the athletes of the safety of the AstraZeneca vaccines.
This is to give confidence to all Bayelsa representatives at this festival that it's safe to take. Of course, we all know that there's been some misinformation on social media and even in public discussion circles. We hope every athlete will be vaccinated.
Athletes in Delta, like others, have received their vaccine doses and they are set to participate in the games.
People are still training and some people are still taking their vaccine. But what we're actually doing is, as soon as you take your vaccine, we allow you to rest a little bit for 2 days. Then after that, you can start up.
In the Northeast, 150 contingents in Borno State have taken the AstraZeneca vaccines, while participating athletes in Adamawa State have undergone tests at the State Infectious Disease Center at the Yola Specialist Hospital. A sports representative in Borno State assures that all conditions for participating in the festival have been met.
One of the prerequisites for our participation there is we have to do vaccine for COVID-19 plus a test for COVID-19. And we have already taken the vaccine. We are here for the test.
In all, Over 8,000 people are expected to attend the National Sports Festival in Benin City, the Edo State capital. This implies that the officials have a big task of ensuring that the COVID-19 protocols set by the NCDC are well maintained to avoid athletes contracting the virus from the Games.
Let's take a closer look at how the pandemic and protocols are affecting sporting activities. Dr. Paul Wakama is the Chief Medical Officer at Team Rivers to the National Sports Festival. He joins me now via Zoom from Port Harcourt. Thank you for joining us on the program. Dr. Wakama, let's begin. First, give us an idea of the effect of the pandemic on the team and, how they feel about the National Sports Festival after so many months at home. Dr. Wakama, if you could please unmute.
No.
All right, great. So I was asking, okay, great. We can hear you now. Give us an idea of the effect of the pandemic on the team and how they feel about the National Sports Festival after many months at home.
Well, the athletes have always been eager to participate, When you are into sports, it's not only a means of livelihood, but it's also a way of life for you. So they were quite anxious. They wanted to participate. And then when they heard eventually that the festival was coming up, they were quite enthusiastic. So they did, all the things that were required of them. So for them, a lot of them have ambitions to go for the Olympic Games and so on. So it was enthusiastic. They were enthusiastic all the way.
And so eventually the rules came out, the do's and don'ts to limit the spread of COVID-19. What do you think about them? And do you think that it is efficacious in preventing transmission?
Well, in a way, yes, because all the athletes, especially those ones in our state, we compel them to take the vaccination, and then they all took the PCR tests. Fortunately, they were all negative from our own end. And I guess everybody also did the same thing. And when we went on getting to Benin, really, the officials were quite strict because anybody who went there also had to do the rapid test as well, while they screened the results of the tests that we did in our various states. So they were quite strict, and kudos to them.
So in terms of adverse effects, were there any for the athletes, for any member of the team? And in terms of, the COVID-19 vaccination, does this in any way affect the performance?
I'm not getting that. Sorry. Can you?
So the question is, in terms of adverse effects that some of these vaccinations have brought out around the world, were there any experienced by your team? And this is also, speaking from the medical standpoint, in terms of performance, vaccinations affecting the performance. Are there any fears that you have?
Well, I took the vaccination as well at about the same time the athletes were taking it. So different people, experience different, side effects of the vaccine. A few of them had complaint of fever. Personally, I had a few minutes of body pains. But by and large, whatever effects they had were just for a short moment. And they trained, even though as human beings, the side effects were few, but athletes are young and well trained, so they were able to get over those very slight and fleeting side effects and continue to go back. No, it didn't affect them. bidding at all.
All right. We appreciate your time. We wish your team the best in the games. We'd like to thank you, Dr. Paul Wakama, Chief Medical Officer at Team Reavers to the National Sports Festival. Thank you for joining us on the program.
Thank you. Thank you very much.
The Ogun State government says it has vaccinated over 58,000 residents of the state in the ongoing exercise aimed at reducing the spread of the virus in the state. The Executive Secretary, Primary Healthcare Management Board in the state's Ministry of Health maintains that so far the exercise has been smooth without any hitches.
Ogun State, where the index case of the coronavirus was discovered on the 27th of February 2020, coincidentally was also the first state in the country to take delivery of its share of 100,000 doses of Oxford AstraZeneca vaccine on the 8th of March 2021.
The state being the first state in the Federation to receive the consignment of 100,000. This is the initial 50,000. And another 50,000 will be arriving in the state later on today.
After a brief ceremony, the state governor, Dapo Abiodun, leading by example, took the first jab of the vaccine, followed by his deputy and other members of the State Executive Council and frontline health workers. According to officials of the State Ministry of Health, over 58,000 residents have been inoculated without any fatality and no complications of sort so far.
Initially, the first 3 days was not that easy, but of course we have to make sure we were able to make sure our team move to some places, strategic places, and after 1 or 2 days, people started coming willingly.
As it is, the vaccination exercise has been received with a mixed reaction from residents.
In order to play safe, there is need to ensure that you play safe. And having established the fact that there is a vaccine for that disease now, I see no reason why I should not benefit from that.
Because a lot of people are scared, they don't actually know the aftermath of what will happen to them if they take the vaccine. And then the government is not giving them enough orientation on reasons why people should take the vaccine.
But the Executive Secretary explains the progress made so far.
We have recorded 204 adverse effects following immunization. 2 are serious and 202 are non-serious. But if you compare these 204 compared to the 58,000 that we have vaccinated in Ogun State, you'll see that it is negligible.
It has not been an easy process, but the Ogun State Ministry of Health and the state government are steadily making progress, an indication that serious efforts are being put in place to ensure that the coronavirus curve in the state is flattened.
Well, Dr. Tomi Koka is Commissioner for Health, Ogun State, and she joins us for more on this. Thank you for joining us on the program. Tell us a bit more about the adverse effects which were recorded. We understand 2 cases were quite serious.
Thank you very much for inviting me this evening. You are right. We had 2 adverse cases, and those cases were one of a gentleman who was an 2 of them were octogenarians. One had septicemia, but he had underlying infection before coming to receive the injection, the vaccination, without knowing. So within sort of 48 hours, he had generalized septicemia. The second individual was also an octogenarian who also developed some tremors and was given intravenous fluids, and the tremors did calm down. So those were the 2 serious adverse effects that we had reported within Ogun State out of the 204.
Dr. Koka, let's go on a quick break. Of course, we still have you joining us. We still have Dr. Koka with us. We also have more on the program. Stay with us. Commissioner for Health, Ogun State, Dr. Tomi Koka, is still with us. taking a look at vaccinations there. Thank you for your patience. What method is the state adopting to the share of the vaccines received? And this is to manage what you have so that, it's within the 4 to 12 week window.
Thank you once again. What we had initially was 113 doses, and we were informed halfway through our 10-day vaccination campaign, that we had to save the half of the doses for the second administration. So we've done that. So far, we have actually achieved 102% of the targeted population. As you know, this is meant to be in 4 phases. The first phase is targeted at 1% of our population, which includes the frontliners, health workers, and strategic leaders. So of that group, we've actually vaccinated 102. So we have the second half of the vaccination, the dosage, which we will start in another 4 weeks, because we intend to vaccinate our citizens from 8 weeks after the first dose. So those are the measures that we're taking to ensure that everyone that's received the first dose actually gets to receive the second dose, which confers a much better immunity than a single dose, as you know.
Finally, have there been any challenges in the campaign so far?
Well, initially, the first few days, probably the first 72 hours, we had challenges with the infrastructure, such as the network and also the e-registration, because the national platform was changed halfway through the campaign. However, haven't got over those 2 challenges. The campaign ran smoothly, and we've had positive feedback from our citizens as to how well we were able to deliver the campaign, including people in the remote areas actually saying that they had access to the vaccine.
All right, that's good to hear. We wish you all the best in the vaccination campaigns. We'd like to thank you for joining us this holiday. Dr. Tomi Koke, Commissioner for Health, Ogun State. Thank you.
Thank you very much, and happy Easter to all.
And we take you to the UAE, Dubai. Christians there are celebrating Easter without pomp and fare for the second year running, as government guidelines on large gatherings and places of worship remain in place. Here's our correspondent, Maiwa Adigoke, with more.
Day 2 of Easter, and celebrations across the UAE remain low-key as Christian faithful devise various means to celebrate despite restrictions on large gatherings.
A hall that goes for about 250. Now you can only have 50 people gathered there. So that has impacted on their attendance.
It has been over 1 year since the country first introduced COVID-19 guidelines, many of which are still enforced. In some churches, such as this one in Abu Dhabi, the capital, all Easter services, Good Friday, Easter Sunday, and Easter Monday have been combined into a one-day affair.
Irrespective of the trying times, the challenging times, we have to make the most of the opportunity we have to still celebrate Jesus even at a time like this.
Many churches cannot conduct services for failing to meet government requirements, and those that can have to ensure strict compliance by managing attendance. Some, such as Fellowship Dubai, employ a unique hybrid of outdoor in-person cells and online services. Water baptism, a Christian ritual tailored after the death and resurrection of Jesus, takes place in this private pool.
Philip, do you ask for baptism?
Yes, I do.
Excellent. Let's baptize you. Come this way. Put your hands like this.
Yeah, it's a bit slopey here.
Yeah, it's okay. Philip, I baptize you in the name of the Father and of the Son.
Easter 2021 is done and dusted, but many continue to hope that someday soon they can gather again and worship in large numbers. From Dubai in the United Arab Emirates, Mayowa Adigoke for Channels Television.
And from the UAE to the United Kingdom, Dr. Armon Imohi is a family physician and GP. She joins us from Merseyside, northwest England. Glad to have you on the program.
Thank you.
All right, a lot of outdoor activities globally and more messaging from countries' CDC emphasizing on less travel. But coming out from the lockdown in the UK, how would you describe the holidays?
The holidays have been really beautiful. The weather has been awesome throughout the weekend. And just before the Easter holiday, on the 29th of March, some of the restrictions were lifted. So 6 people or 2 households were allowed to or are allowed to meet, even in the private gardens. So that's been really useful during the holiday because families have been able to have barbecues and just have a good time.
But in terms of the risks, reopening risks, a lot of people have also been talking about that. How is government handling that?
So in terms of the risk, I think the main risk is the fear of a surge in positive cases once the lockdown restrictions are taken off. But the good news is that the vaccine uptake has been very positive. As of today, over 37 million people have had at least 1 dose of the vaccine in the UK. And out of those, 31 million have had the first dose and almost 6 million have had the second dose. So I think that's one positive in the sense that a lot of people are getting vaccinated. And then there's also a plan for rapid testing once the lockdown restrictions are eased off so that people can, we can find out if someone is asymptomatic but has the COVID virus, at least we know. So those are things in place to help.
Finally, talk to us about the vaccine passports. Government's announcements of the launch of COVID passport pilot from mid-April. Do you think that this is viable?
There's still a lot of controversy about this, and there's still a lot of it's still in the process. Nothing has been said has been set as solid yet. But obviously, vaccine passports are not new. So as we know, some people have to take yellow fever vaccine passports or certificates when they travel to countries where there is no yellow fever. And that's kind of going to be the same. It's just going to be more digitalized. So with the vaccine passports, it's just so that people have a document showing that they've had the vaccines.
So essentially trying to balance public health measures vis-a-vis people's livelihoods. All right. We appreciate your time. Yeah. Thank you so much. Dr. Armon Imohi is a family physician, GP from Merseyside, northwest England. Glad to have you on the show.
Thank you. Thank you.
India has reported a record rise in coronavirus infections, becoming only the second country after the US to register more than 100,000 new cases in a day, as hospitals in its worst affected state are overrun by patients. The country's daily COVID-19 cases soared today, the biggest such daily increase, according to data from the Health Ministry, taking the total to 12.6 million, the highest after the US and Brazil. Deaths jumped by 478, still one of the lowest death rates in the world, raising the total to over 165,000. India has recorded the most number of infections in the past week anywhere in the world. Continue to take responsibility, and if you have symptoms associated with COVID-19, then please visit one of the sample collection sites in your state. You can find more updates on our website, that's channelstv.com. Thank you for watching. I'm Millicent Walker. Stay safe and stay healthy.